What happens is that it's not only nurses and doctors who are leaving, but the quality of nurses and doctors who are leaving. A nurse who has worked for 20 years, very experienced, or 10 years, nurse, very experienced, or doctors with experienced surgical skills, or even specialists are leaving. So it's not simply just training new doctors and nurses, replacing the ones who are leaving, but the wealth of experience they've built. So it's really a grave situation, and we are happy the ministry was here with us, other stakeholders, and we hope to start putting in some measures so that we can plug the brain drain.
We have some statistics. How scary is the situation in terms of the brain drain and its effect on the country's health sector?
Well, the figures we have, about 20,000 nurses have left the country over the last 2 years. That is huge. If you think of the fact that a big hospital can employ, let's say, 100, 150 nurses, and 20,000 leave, so you can imagine how many hospitals are now without nurses. So, and the doctors, what the statistics we have is that half of the doctors who have been trained in Ghana are working outside Ghana. And they are actually attracting the doctors with a lot of deals. I mean, there are some states in the United States of America where now you don't even have to write their licensing exams. You can come in with the African qualifications you have and start working before you go and write their licensing exam. So they're making it easier and easier for our experienced, and well-valued health personnel to leave. So it's really very scary, and the time to act really is now. Otherwise, I mean, the campaigns are still ongoing, and we may lose very valuable youth. Yeah.
So going forward, how do everyone, all stakeholders contribute to turn the brain drain to brain gain? What is your final word?
Okay, you see, it has to be a collaboration between the government and other sectors. There are several factors that feed into the brain drain. Okay, bottom line of it is the economy, because the richer countries can pay more, so they are attracting others. We cannot really sort of match what they offer our doctors and nurses out there, but to some extent we can make conditions a little better and make our doctors and nurses a bit comfortable. If we make them comfortable, there are other factors that we have in our sub-region that can keep them. I mean, we have a beautiful weather, our social connections, family connections. This environment is not too stressful. It's not a police state like other Western states. So those factors are there. So when you can do a little more, it can help. Now, the government can also lessen some of the taxes and make the business environment for the private sector easier for us to expand and take on some of these doctors and nurses and keep them here. So, but already with high technology, some of the private people are already into high tech, high technology medical equipment and medical procedures. And some of the reasons why our doctors leave is that they want to be abreast with the latest technology and techniques. We're already having them here in Ghana. But sometimes importing them is very expensive at the port and so on. So we need government to try and waive off some of these import duties on medical equipment so that we can have them available for, to train our doctors and nurses and retain them.
Thank you, sir.
My name is Dr. Med Andre Kwisikuma, President of the Society of Private Medical and Dental Practitioners.
And we say so because looking at the total number of healthcare practitioners that the country is producing and the job opportunities available to them, there is a mismatch. And I rightly said in my speech today, in my fraternal message to the association, that since the year 2020, to be more precise, we have not had any permanent employment into the Ghana Health Service. So if the government, being the biggest employer, has actually not employed any pharmacists into permanent job, it's quite a worrying situation for us. And today we have about 8 pharmacy schools or 8 pharmacy institutions, and we have numbers about 1,000 pharmacists going to come out every year. If you have 1,000 pharmacists coming out every year, and for 4 years the government has not employed any permanent pharmacists, any pharmacists into permanent employment, that is a case for worry. Today, as we speak with you, a number of the young pharmacists are leaving their countries. And listening to the speech of the president of the Ghana Medical and Dental Practitioners Association, they also made it quite clear that about 60% of all those who have been trained here are not in the country, according to the statistics that they also read out. So brain drain is actually a problem that is affecting the health sector. People would want to stay and work, but the job opportunities are not here. And even if they are here too, people are not also adequately remunerated. These are the two factors that are pushing our members out of the country.
And from your side, what should we be doing as a people, as a government, to move from brain drain to brain gain?
I think there are two things that needs to happen. The government itself should make a conscious effort to employ pharmacists on our side. If every year 400 or 500 pharmacists are going to be employed, to ensure that every health facility in this country there is a pharmacist. Anywhere medicines are being dispensed, they need to make sure adequately there is a pharmacist. Not only will the pharmacists be at the pharmacy department, but they will also be available at the various wards to also provide pharmaceutical services. So that the government needs to do. Then in the private space too, then we expect the regulators also to create an enabling environment for many more pharmacists to be engaged in the private sector. And that means that at any time the pharmacy is open, there should be the presence of a pharmacist. If the regulator is to insist on that, that would also create employment opportunity for our members. So we look at both private sector and we look at the public sector.
When you say enabling environment, what exactly is the enabling environment for you people?
The enabling environment is that the law says that anytime a pharmacy is open, there must be the presence of a pharmacist. So if the regulator is to crack the whip to ensure that when the pharmacy is open, there must be the presence of a pharmacist. The second issue is that we also have over-the-counter medicine sellers. Most of them need to upgrade to pharmacy. At the time they were granted the licenses to be able to operate as over-the-counter medicine sellers, Ghana had only one pharmacy school, which is the KNUST, and we were producing about 50 pharmacists a year. Today we have 8 pharmacy schools producing about 1,000 to 1,500 pharmacists a year very soon. If you're talking about 1,000, should you still find over-the-counter medicine sellers in the regional capitals, in the national capital? No. All of them need to upgrade by employing pharmacists to ensure that the professional role of the pharmacist is always at play when it comes to dispensing of medicines, when it comes to administration of medicines. So these are the things we talk about when you create the enabling environment. Whilst government would also recruit more pharmacists to make sure that they are in the public sector space.
You mentioned in your speech that government has not paid particular attention to you in terms of tax incentives and all of that. Would you want to speak on that as well?
I think what I mentioned was that for almost all the pharmaceutical companies, the hospitals, the laboratory diagnostics who are in the private sector, they are seen more as a business entity when indeed they are providing health services. So if the government is to see a private clinic, a private hospital as a facility that is providing services or health services, or if it's pharmacy, then we are talking about pharmaceutical services. Then when it comes to taxation, they wouldn't be treated like an ordinary business. So it's possible for even a law to be made such that in terms of corporate taxes, all these private sector organizations will pay less taxes because they are providing health services. And remember, that is saving lives. So these are organizations that have set up to actually save lives, also to make interventions by slowing down disease progressions in various areas. So you improve the health outcome, and we all know the health of a nation is what? The wealth of a nation. So if the government wants to give it preferential, or put a preferential arrangement in place where in terms of tax obligations, these private health facilities would be treated accordingly or be given preferential treatment, it wouldn't be bad. So these are the expectations of the private healthcare. I'm not saying this for only pharmaceutical companies, but the entire private healthcare industry. Those hospitals, the laboratories, the community pharmacies, all of them deserve to be given a preferential treatment when it comes to taxation, because they are providing services beyond just business.
Thank you so much. For the purpose of the interview, your full name and your role.
My name is pharmacist Dr. Samuel Kordonko.